Thank you very much for listening to the 26th Annual Miracle Marathon, benefiting the kids here at Children's. And a couple of weeks ago, Doreen and I were, well, let's just say the experience behind the scenes we had here at Children. I was going to say we were blown away, but I think that's an understatement.
Yeah.
What we were privy to and what we saw behind the scenes here is really hard to articulate, which is why we invited this guy, because he's the one that helped us go through the behind the scenes experience. Dr. David Gourlay, who is the Surgeon in Chief, Children's Wisconsin. So you're also a professor at Medical College of Wisconsin, right? Chief of Surgery. Dr. Gourlay, thank you so much. And one of the things that you taught us was when it comes to traumas, it doesn't just happen by accident. And I referenced this a little bit yesterday, that in all the years of hosting this event, I literally never gave one thought to why, when a traumatic event, something horrific happens, such as the Waukesha Parade, let's say. How does Children's accomplish what they accomplish? And Dr. Gourlay is here to speak on that. First of all, thank you for your time. Thanks for spending time with us.
Yeah.
Doing the experience.
Educating us.
And educating us. But let's talk a little bit about the trauma that you guys deal with here at Children's.
Yeah, well, thank you first for having me and letting me have the opportunity to speak about it. As we talked about, it's something we're very passionate about. And we're very proud of our pediatric trauma program that Children's has committed to being a level 1 American College Surgeons verified pediatric trauma program. There are only a handful of programs across the country that commit to being able to provide that level of care. And it's a rigorous review process that looks at not just the care that we provide, but our commitment to doing things like injury prevention, research, and education, but also being able to provide care to the most severely injured kids possible, and having the resources and the response to deal with things like the Waukesha Parade tragedy.
That's key, I think, is having the resources to be able to handle that.
So, to give you an idea of what Doreen and I witnessed, we walked in, Dr. Gourlay explained what was going on, and when there is a trauma, there are upwards of like 12.5 people in the room, all with very unique, specific duties and responsibilities. But the amazing thing is, these are people that are coming from various and different departments throughout the hospital. So they may not have ever worked with one another before. They may not have even known one another before. So how does it work so seamlessly? And that's what one of the many things Doreen and I were privy to, is to watch them actually rehearse. And the day we were there watching, they were rehearsing dealing with someone coming in with a gunshot wound.
Right.
And the other thing you need to know is it's not just a quote-unquote like dummy that's on the table. It's actually hooked up through sensors and through software, and the quote-unquote robot or dummy on the table reacts like a human, and they can program it to do different things, right? Like it can crash, it can whatever.
Stop breathing.
And so you guys, like, you actually record all this stuff, much like the Packers do, and then you go over it, right? You parse it like bit by bit on how you can do things better.
Yep, it's exactly that. It's practice. And you're right. In a moment's notice, we'll get a page through our partnerships with many of the Milwaukee and Milwaukee County EMS agencies that will notify us, hey, a patient is coming in. That team will have to gather and respond to somebody that is severely injured, potentially has life-threatening injuries. We're going to have to figure it out quickly and make the diagnosis and make the treatments in a moment's notice. That team has to work together as a team.
And they have to know their roles. And when we watched that, everybody knew their roles. And it was okay, we were told as we were watching, for them to question something if something was happening in that heat of that moment that they didn't think was right, or they thought something different. And in their training, they're able to bring that up and question and learn, and it was fascinating.
Yeah, and that's a big part of the training, is getting everybody comfortable with their roles, knowing their role, and also being comfortable speaking up. There is a leader, you need a leader, but everybody's job is to make sure that they keep the patient safe. And so we practice. Everybody's expected to go through those simulations that you described, a couple times a year, and we bring back events that we've happened that we've learned from, so that we can practice what went well, what didn't go well. We also record our trauma, our actual traumas, so that we can review them and identify what worked well, what didn't work well, and we talk about them after the event to figure out what we can do to make things better.
And these trainings happen not on their shifts,
Correct.
right? So it's either before or maybe after.
People spend their time outside of their daily job to come in and do the training as a team.
And that's why it works so well. Like, that's the reason why. So when something in this community happens and it's a traumatic event and there are kids involved, we all just naturally assume, okay, they're going to take those kids to Children's, and Children's is going to do the best work that can possibly be done. But how does that occur? And that occurs because of the man and woman power and all the hours of rehearsing and training and practicing for that. It's not an accident. But above and beyond all that, the biggest thing is prevention. So we tried to preach during the radiothon, during the Miracle Marathon, that you don't want to be here for a trauma. So you need to do things like wear your bike helmet, make your kids wear their bike
Your
helmets.
seatbelts.
Seatbelts. Don't ride around with a kid on your lap on a lawnmower. Car seat safety is a big thing
Right.
here.
Yes.
Yeah.
Yeah, providing the right car seat, knowing how to put it in. They're like
And it's not
crazy
just-
contraptions now.
And like we talked about yesterday, imagine if your little one had, say, some sort of orthopedic surgery.
And they're
You
in a
can't
cast.
strap them back into the same car seat. I mean, there are things that need to be done, and
None of that just happens.
no.
And we're fortunate here that Children's recognize that as important. That prevention's a big part of our program, not just for the trauma program, but for Children's in general. And so when kids come in to us for any reason, we talk about things. Do you have a car seat? Do you have a bike helmet? Have you been vaccinated? All those things that keep kids healthy, those are questions that we ask every time when we
Right.
see patients, so that we can help with that prevention piece of things.
Same with the mental health questionnaires now.
Absolutely. Mental health is a big part. It's a big part of our trauma recovery, is the mental health. We're really good at putting people back together physically. The mental piece is a big part, getting them back to school, getting back to their sports, getting back to activities. It's a big part of our trauma
It's
program.
a normal.
So, for lack of a better phrase, you, doctor, are in the trenches every day. You're with the patients, you're with the other caregivers, the other surgeons. How does philanthropy help you specifically in what you do?
Yeah, that's a great question. So those things that we just spoke about, it takes time and money to do the trauma simulations. There's a lot of effort to coordinate a simulation and plan for it that happens behind the scenes. You got to bring people in when they're not working in order to do it. So there's an investment in that education piece. The research is also a very important part of the trauma program, trying to prevent injuries, and a lot of the preventative strategies, buying car seats, buying bike helmets to give out, things like that. We invest a lot of money in to give those things out so that those kids don't come back to us injured.
Not covered by insurance.
That's not covered by insurance. It is
Gotta come from somewhere.
comes from Children's, and it largely comes from philanthropy.
Well, thank you very much for showing us behind the scenes what was going on, and also for enlightening us today. We appreciate
Yes.
your time. Thank you.
Thank you.
We appreciate it. Dr. Gourlay, let's give it up for Dr. Gourlay. He is the Surgeon-in-Chief here at Children's Wisconsin. And we do have a brand new total, just came in. If we can hit the total board, here we go. All right, it's 8:01 on this Friday, so as of a minute ago, our total is now $614,044.44. Thank you very much. And how about this? We actually have a power hour at this point,
Yep, starting now.
starting right now, thanks to Pediatric Home Service, an independent children's home health care agency. Pediatric Home Service is there for one reason, helping kids with medical complexities live as fully as possible at home with their families where they belong. So thanks to Pediatric Home Service. They are doubling your money. Whatever you can afford to donate
Now
from
is the
now.
time.
Now is the time, from now until 9 o'clock. Please make a difference in the lives of these kids and families. And we just got done talking to Dr. Gourlay about the trauma that they deal with here at Children's and the expert care that's given. But in some cases, no matter how much care they're given, it does not end the way we want it to end. And specifically, I'm talking about little Jordan Sparks, who tragically died because of what happened at the Waukesha Christmas Parade. And to that, we are going to talk to Sherry and Aaron, mom and dad, about that Waukesha Christmas Parade and what they've been dealing with. They lost their son Jordan, and they will tell us the story next as the Miracle Marathon continues on KLH.